Interventions with a king. Discussion and commentary based on articles from Jack, Cardiovascular Interventions.
Hi, David Moliterno, one of the editors for Jack Cardiovascular Intervention, and I'm joined today by a friend and colleague, Joanna Wykrzkowska, and Joanna's going to tell us about a paper that she and her colleagues from Erasmus Medical Center, the Thorax in Rotterdam, have completed dealing with the ARTS-1 and ARTS-2 paper and diabetics in particular. So Joanna, tell us a little bit about this study you have.
Sure, it's a pleasure to be here, so thanks for having me. And it's a pleasure to present on behalf of my colleagues. So indeed, we did a sub-study. It's a post-hoc analysis at 5 years follow-up in ARTS-2 and ARTS-2 studies, looking specifically at the diabetic population and the outcomes in that population. Focusing on clinical outcomes, the primary endpoint was essentially MACE, and then secondary endpoints, the subsets of MACE, both safety and efficacy endpoints, and then also stent thrombosis at 5 years. What we found out mostly is something that confirms the results of other studies that have slightly shorter follow-up, is that drug-eluting stents, sirolimus-eluting stent treatment of patients with diabetes is as safe as cabbage at 5 years follow-up. Of course, the efficacy there is different because you do have more events, clinical TVR at 5 years with patients treated with sirolimus-eluting stents. In addition, we had the historical control of bare metal stent-treated patients, and that actually flunks the safety test. So you actually get higher number of MIs and you get worse MACE.
You had done a previous paper, the group had done at 2 or 3 years. So,
3 years, yeah.
So what's different now out at 5 years as compared with 3 years?
So it appears, if you look actually at the Kaplan-Meier curves for MACE, that after 3 years, the patients treated with sirolimus-eluting stents have more and more MACE events, and they tend to start to maybe catch up to patients treated with bare metal stents. And, the interpretation of that, whereas at 3 years, the curves were essentially kind of asymptoting at their, respective levels with the respective differences. I think this may not be, target vessel failure or target lesion failure, but rather, I think, disease progression in this really sick patient population. And what I think might be interesting in the future is to actually start looking at what Syntax trial started to look at, although it was underpowered for that, is how this breaks down when you actually start to look at the levels of Syntax score and how complex disease is to begin with in those patients.
So in summary, out at 5 years, cabbage still looks very good. Sirolimus-eluting stents still look good, maybe not quite as good at 3 years, but still good, and bare metal stents a clear loser, I guess.
Yeah, no, absolutely. I mean, I think sirolimus, we can say, is safe as a treatment, but efficacy is not quite there.
Perfect. Beautiful. Thanks so much for joining us today, Joanna.
Welcome.
Again, David Moliterno with Jack Cardiovascular Intervention. Thanks for joining us.